Welcome everybody. So welcome again. We are going to start this entire thing with the first week. There is a prior video on this channel a couple of months ago. Probably I think it was like 3 months ago from this recording, wherein I discuss about what each week will have in its contents. But we'll start. So week number 1: the art of philosophy of medicine. The art and philosophy of medicine. So it's really important and I think very sweet to think about medicine not as a hardcore technical and brutal science out there, but to understand that it evolved and it was made out of people's desire to understand science and life and human nature better. Evolution of medical reasoning. So many times when you are in your medical school, you're looking at people sharing things that they have learned, or you're in your classes understanding things that your lecturers or your teachers tell you. You might almost always get into this thinking that everyone out there knew the answers to all the questions which are out there, but that doesn't usually happen. What rather happens is, we as a species have had many situations and many occasions where we collectively believed a certain thing to be true, and then based on new evidence we were like, okay, let's move on to something better, which explains more of our observation, more of the things that we see. I'll try to talk less and try to get through the presentation fastly. So from ancient to modern times, this is how medicine has progressed. Firstly, we had Hippocrates, who came up with the idea of humoral balance and clinical observation. Humoral balance is basically that human body has like a bunch of humors. Humors are liquids, which we will talk about in detail later, and the way that they fit in together is how we have basic human physiology going on. Osler. Osler was a scientist which came after, and his name is even used in like some of the conditions, which you could Google it. First few minutes in the video, and the guy tells you to Google it. No, I'm just kidding. But we will get to that. We'll get to that. What he proposed was, let us listen to the patient. Let us listen to what he's saying, because he will tell you the diagnosis. After Osler came the post-Osler era, where there was rise of diagnostics and evidence-based medicine, EBM, which we currently practice. And now we currently live in this era where we have integrated reasoning, wherein we follow bedside logic with biochemical precision and systems thinking.